everyone, buckle up for a new episode of Bumpaholics, the one and only podcast made to teach you all stages of the arrival of baby, before, during, and after. Whether you're expecting, have questions about fertility, have difficulty with lactation or postpartum, you're sure to learn from our experienced doulas when you listen to Bumpaholics. So today we'll be diving into pregnancy week 12 with me, Brittany. Join us in the comment section for today's episode of the Trimester Journey. Welcome to another episode of the Trimester Journey. I'm Brittany Brownell, certified birth and bereavement doula, certified birth photographer, education director, and volunteer with Casey Women's Ministry, and mother of 3, soon to be mother of 4. So this week, let's start off with symptoms first. This week, my nausea really started to decrease, which is fantastic. However, I've started to get some heartburn, which I wasn't really surprised about. But I didn't have Tums on hand, so I did a few rounds of a teaspoon of baking soda in 8 ounces of water. It tastes awful, but it does work like a charm. So some other things that can help reduce heartburn: eat smaller, more frequent meals throughout the day. As baby grows, your stomach gets kind of smushed, and that food that you're putting in there or liquids is kind of being pushed up toward the opening at the top. And the relaxin going through your body is relaxing the esophageal tube. So that's a ligament there that's holding everything in. And as that relaxin is relaxing all the ligaments and everything in your body, it makes it a little more difficult for that particular ligament to hold all your gastric juices into your stomach. So putting less pressure on that can help reduce that heartburn. You can also reduce spicy foods, greasy or fatty or acidic foods such as citrus and tomatoes. Really hard one for me because I like both of those things. After you eat, remain upright. It can really help keep those contents in your stomach where they're supposed to be. When you're sleeping, sleep on your left side. So the shape of your stomach, it's kind of this U shape, and the deepest part of that U is actually on the left side of your body. So by sleeping on the left side, it's putting more of that liquid into the stomach cavity rather than, so think of it this way, here's your stomach, and when you're sleeping on your left side, you're putting your stomach this way. But if you sleep on your right side, you're putting your stomach this way. So all that liquid is going into the esophageal opening. So all those lovely hormones that are helping your body give life to this beautiful baby, relax your muscles, which means the valves. Oh, I said that already. Ha 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 ha. So as your uterus, I said that part too. Some other symptoms that can start showing up this week or next week are some increased vaginal discharge, check. Some headaches, check. Increased saliva, increased flatulence, check. I just blame it on the baby. And my husband and I laugh about it. But you can also have just a heightened sense of smell, and I'll check that one off too. Even through, I'll just check that one off too. All right, so let's get a physical update. How big is baby this week? Well, baby is approximately 2 to 2 1/4 inches long. It's about the size of an apricot or a small lime. So this week, your baby is starting to develop reflexes. Those fingers and toes are starting to curl, and they're starting to do sucking movements with their mouth. So they're practicing their nursing skills, their breastfeeding skills. So if you poke your belly, your baby will most likely respond by wiggling. You probably won't feel it yet at this point, but because those reflexes are developing, they're gonna move when you poke it, which is pretty fun if you do, when you do start to feel that. So your baby actually has a neck now. They can start to lift their chin off their chest, because before they didn't really have a neck. They were kind of like this, excuse the double chin. But now they have a neck and they look like they have a little body going on. So this week, your baby is actually starting to practice to breathe. They're breathing, of course, the amniotic fluid, but it is giving them some good practice for when they're born. All right, let's talk about your nutrition for this week. So something that I've been thinking about, it's been on my mind, I'm on the heavier side of what is considered healthy for my size. So, I'm wanting to make sure that I'm eating the amount of calories that I'm supposed to eat while not overeating. So I did some research. This week, your recommended caloric intake, and this is going to be just basically through pregnancy. I've got some information here for each trimester as well, but basically throughout your entire pregnancy, it's about 300 more calories than when you were not pregnant. And that is based on the American Pregnancy Association. So ACOG actually indicates the caloric needs by trimester, or actually not necessarily by trimester, but by the amount of children in the belly. So if you are pregnant with a single baby, then they recommend about 340 calories, which is a little more than what the American Pregnancy Association is recommending. If you're having twins, they recommend 600 calories. So we're doubling that in that amount of calories for one baby. And then if you have triplets, we're going to add another 300. So they're recommending an extra 900 calories a day. It seems like a lot, but that's really not that much when you're considering each baby needs approximately 300 calories for your body to grow. Medlineplus.gov outlines an approximation by trimester, and it's not giving you just the additional calories that you need, but rather the full amount of calories per day. So it's standard to eat for a normal, basically a general weight person who's going from totally sedentary at 1,600 calories to a fairly active individual at 2,400 calories. That's also going to depend on if you're a male or a female for your caloric intake. So, sorry, my shoe got stuck. So you can research that or go based off of your BMI, but it is recommended for 1,600 to 2,400 calories for a non-pregnant person. During your first trimester, they're indicating about 1,800 calories. So remember, we're looking at 300 extra calories a day. If we're starting at 1,600, then we're going to add that 300. They're not adding quite enough to that. So we're looking actually at more like 1,900 calories for the day. For your second trimester, that's where they're adding that extra bump. They're looking at 2,200 calories a day. And for the third trimester, they're looking at about 2,400 calories a day. And that is because during your third trimester, your baby is adding the weight, adding the fat, padding their body so that when they come out, they can stay warm and they're healthy. So if you really need help maintaining your diet, talk to a nutritionist. You can also look up the Brewer Pregnancy Diet Plan, which is another great option if you are comfortable making your own diet plan. You can continue eating how you're eating now, just making sure that you're getting the recommended amounts of nutrition, such as protein, which is the building block of life, by the way. But basically the Pregnancy Diet Plan by Brewer, so the Brewer Pregnancy Diet Plan, explains what basic foods a pregnant person needs to eat daily, and it lists out some options for you. It lists out those things and it gives you a checklist. So you can say, okay, today I had X number of servings of legumes or whatever. They're giving you a lot of information. They even have variations for people with complications like preeclampsia and anemia. So it's a great resource. I highly recommend checking it out. Let's see. When should you call your provider this week? If you have really persistent heartburn throughout your pregnancy, this week, throughout the pregnancy, maybe you're not having it persistent now, but it's starting to buid, call your provider. Let them know you're experiencing heartburn. Just to have a discussion with them at your next appointment if it's not super persistent, but let them know you're having this problem. They can give you some additional information, or if it is a more intense problem, they can even give you a prescription for that heartburn that is safe during pregnancy. So as your pregnancy progresses, you may find that you or your partner are actually stressing about what the future holds. That stress can lead to some depression, sadness, or anxiety. If you're feeling these feelings of sadness or even hopelessness, reach out to your provider, talk to someone, find a family therapist, find a counselor, go with your husband or your spouse or your boyfriend, or baby daddy, baby mama. Go with whomever you feel comfortable, or go by yourself, but find help and talk to someone. Reach out to your provider so they can give you some resources in the area. Maybe you just need to find a support group, find other people going through what you're going through at the moment. It can be quite stressful to think about what that future holds, whether that's the upcoming labor and birth or just future in general and what life is like with the baby. So talking through those things can really help. All right, let's talk about some next steps for this week. Keep moving, be active. Exercise can help you feel better. It helps boost your mood, improves sleep. It reduces aches and pains and prepares you for childbirth. It's going to prepare your body physically and mentally for this process of having a baby. In the coming weeks, you're also going to start seeing some procedures and tests that your provider may need or want you to do. Most of them, pretty much all of them, are optional. If you have questions, ask questions about those tests. You can definitely take a look at some of these tests beforehand so that when you go in and they say, hey, we need to do an RH factor blood test, you're going to know what that means. So they're also going to be looking for some indicators of anemia, sexually transmitted diseases, and ID any blood clotting issues that you have. So they're looking at your platelet count. Later in pregnancy, they'll do a diabetes test and a GBS stress test. Take a look at what those are. What do those entail? How do you do these tests? Do you need it? If you don't want it, why not? And identify these things now or in the coming weeks so that you can either ask questions so you can make a better informed decision, or make your decision and write it down so that you don't forget what that decision was and why you made that decision. You can choose to modify these tests. There is an option with a diabetes test where you can do an alternative. I don't remember what the alternative is. That's a great question for Jamie, and I would be happy to look that up and talk to her if anyone is interested in what that modification is. There are also things that you can do during your pregnancy to lower your risk of a positive GBS test. You're wanting a negative test, so we want to lower that chance of having a positive test. Now's the time to do some research on these two tests and how you can mitigate them. Early on in your pregnancy, you might be given an option to do a genetic test. It's worth looking into the specifics of the test. It can tell you all kinds of things. Are you the kind of person who wants to know if your baby might potentially have Down syndrome? Do you want to know now, or would you prefer to wait until baby comes? Would that stress you out, or would that help you prepare? If it's going to stress you out, I probably wouldn't do the test. But if you think it's going to stress you out more to not know or not have that answer, then go do the test. The test, to an extent, can tell you if you're having a boy or girl. There is a limitation with that of if you have previously had a pregnancy with a boy, it's not going to be as accurate because you already have what they're looking for in your system that identifies a boy. Depending on your job, it's time to start researching and reviewing your employee guidelines to find out about your maternity leave or paternity leave. You should also probably review your health insurance and identify what exactly is covered. So with my first, I worked a corporate job and my health insurance only covered one sonogram. I didn't realize this. We ended up having 2 sonograms and we had to pay out of pocket for the second one since it wasn't technically prescribed by the doctor. It was just recommended and scheduled. which I don't see how that's not prescribed if they're scheduling it, but whatever. And when my husband was looking for a new job, and we were comparing health insurance, we found that one of them only covered prenatal care. It didn't cover the hospital care. So the birth itself and all those expenses related to birth in the hospital would not have been covered. It would have been totally out of pocket. That's potentially thousands of dollars. So that's something that's very worth looking into. Do your research and know what you're in for. All right. I hope you enjoy this episode of Bumpaholics. Again, you can find more information on kcwomen'sministry.org. Thank you so much for joining us today for this episode. Bumpaholics is available on YouTube and wherever you get some podcasts. So if you have a comment, please put them in the comment section. We do review them. Like and subscribe so you don't miss any future episodes. We post a new episode every week and we love having you here. So goodbye for now. We'll see you again soon.